Well, now I'm going to present the treatment of endometriosis associated. First is presented by Miguel Ángel Ponceño of Medical English class. A definition: endometriosis is a chronic estrogen-dependent condition that causes dysmenorrhea and pelvic pain. Elagolix, an organopeptide gonadotropin-releasing hormone antagonist, proves partial to nearly full estrogen suppression in previous studies. Now video.
Endometriosis is a prevalent, chronic, and debilitating condition affecting about 1 in 10 women of reproductive age. There are many symptoms of endometriosis. The most common are dysmenorrhea, dyspareunia, and pelvic pain. Symptoms often vary and may differ from patient to patient. This is complicated further, as symptoms caused by endometriosis are easily mistaken for those of other conditions. A definitive diagnosis of endometriosis based on symptoms alone can therefore be difficult, leading to an average delay of 8 to 10 years in reaching a diagnosis. Endometriosis is characterized by the presence and proliferation of endometrium-like tissue outside the uterus. For instance, on the fallopian tubes, on the bladder, and other pelvic structures. This tissue forms so-called endometriotic lesions that are associated with chronic inflammation and can result in adhesions in the pelvic cavity. 3 main types of the disease can be distinguished. The endometrial lesions are influenced by the female hormone cycle in a similar way to the endometrium itself and respond to estrogen with cell proliferation and lesion growth. In contrast to the uterus, chronic inflammation is observed in the area of ectopic endometrium. A range of medical therapies as well as surgery, often in combination, are used in the management of endometriosis. Medical treatments can be categorized into painkillers, which only treat the pain symptomatically, and hormonal treatments, which influence the underlying pathology. Since endometriosis is an estrogen-dependent disease, one common mechanism of hormonal treatment is to lower the
Now, the applications in medicine. Elagolix, a gonadotropin-releasing hormone antagonist, was effective in improving pain relief with menstruation and pelvic pain among women with endometriosis compared with the use of placebo, according to the results of 2 phase 3 clinical trials. The pros. The authors argued that injectable GnRH agonists are effective and reduce estrogen levels to more postmenopausal levels, since side effects include progressive bone loss and severe vasomotor symptoms. The agents can be used only for 6 months without hormone replacement therapy. Secondary endpoints include reduction in pain from baseline to 3 months as measured with the numeric rating scale, as well as significant reductions from baseline to 6 months in pain scores for dysmenorrhea and non-menstrual pelvic pain.
Traditional treatments. Treating endometriosis is often an experimental endeavor, with doctors and patients having to cycle through several treatment choices before finding something that works. Traditional options include pain medication, often prescribed to treat the increasing levels of pain. It is important to note that pain medications will not treat the actual disease, though. Patients are given hormone treatments. Endometriosis is often associated with elevated levels of estrogen, therefore making hormone treatments a common path doctors pursue. Keep in mind that women hoping to conceive will not be able to achieve pregnancy while on these treatments. Birth control pills are used to regulate hormones and to decrease the menstrual flow. Lupron, which originally developed for advanced prostate cancer patients.
Now the cons. Adverse events include hot flushes, decrease in bone mineral density, and higher levels of serum lipids, all of which were significantly higher in the intervention groups. The authors wrote online in the New England Journal of Medicine there was one death, a suicide in the lower dose Lagolex group in AM second trial. Overall, 10% or less of the women discontinued participation due to adverse events.
The bones in our bodies are alive, growing, and changing all the time. Our bones are composed of different layers. The outer surface of bone is called cortical bone. This is the smooth, hard part of the bone that we can see when we look at a skeleton. Inside the cortical bone is the trabecular bone. This type of bone looks like a sponge and helps to protect the bone marrow. The constant process of bones growing and changing is known as bone remodeling. This process is carried out by specific cells in our bones. Cells called osteoclasts have the role of breaking down our bone and removing any parts that need replacing. At the same time, cells called osteoblasts have the job of making new bone and helping to repair any parts of the bone that have been damaged. On Earth, in healthy individuals, this process is normally balanced so that the same amount of bone is made and broken down.
Issue apply in Ecuador. Hugo Capello, an Ecuadorian gynecologist, has commented at Redaction Medica that 8 out of 10 patients attending a consultation due to infertility problems have endometriosis, a pathology that consists of the appearance and growth of endometrial tissue outside the uterus, especially in the pelvic cavity. We have a program that consists of visiting each month a different city. There we meet with other gynecologists who agree with this high number of cases, he said. According to Capello, the social changes that women face today contribute to the growth of this phenomenon. In addition, has explained that in previous decades report fewer cases because women became pregnant earlier. Now the conclusions. Both higher and lower doses of Lagolex were effective in improving dysmenorrhea and non-menstrual pelvic pain during the 6-month period in women with endometriosis associated pain. The 2 doses of Lagolex were associated with hypoestrogenic adverse events. Thank you very much.